Ms. Rivera, if you were queen for a day and you had unfettered discretion to establish a national rule on abortion for America, what restrictions, if any, would you implement with respect to abortion?
Thank you for your question, Senator. I would, so the American College of Obstetricians and Gynecologists oppose restrictions that are not based in medicine, right? People need to be able to make their own reproductive health care decisions, and having arbitrary restrictions lead to the situations like we've been hearing about, like Kate Cox and others who are not able to get the health care they need during obstetric emergencies. We know the majority of people access abortion services early.
Maybe I wasn't clear, because I've got to ask each of our witnesses here. Just tell me, if you could implement any rule, what restrictions, if any, you would put on abortion.
Senator, arbitrary restrictions put women's health in danger.
What happens when a U.S. Senator asks, should there be any restrictions on abortion? You'd expect a straightforward answer. But this tense Judiciary Committee hearing might surprise you. We're breaking down the exchange between Senator John Kennedy and witnesses Dr. Rivera and Dr. Dennard.
So that means no restrictions?
Senator, healthcare needs to be driven by medical practice and medical standards of care.
You don't believe in any restrictions on abortion?
Healthcare needs to be driven by medical standards of care.
Well, your website says you support abortions at all gestations. So
that is correct, because
you support
abortion needs
without
to be made
any
available
restrictions
based on medical standards of care.
How about, could you get it, if the mother's healthy and the baby's healthy, would you support an abortion the day before birth?
Actually, that is not how abortion care works,
Yes, ma'am, but would you support that? You say no restrictions.
That is called labor and delivery, Senator.
You support no restriction.
That is not how abortion care works, and it's
Sure
really,
it does.
That is not how
my
abortion care
question's
works,
simple.
Senator.
Would you have a rule saying that if a healthy mother with a healthy baby wanted to have an abortion the day before birth, would it be okay with you?
Senator, that is not how abortion care works, and it's really dangerous. That rhetoric is really dangerous for the people who are confronting
It would be
these
okay with you, wouldn't it?
Senator Kennedy opens with a bombshell. Ms. Rivera, if you were queen for a day and had unfettered discretion, what restrictions, if any, would you place on abortion in America? It's the kind of question that cuts through political noise. She says medical professionals, not lawmakers, should guide abortion policy. But Kennedy isn't letting go. He keeps pressing.
Dr. Dennard, if you were queen for a day, what restrictions, if any, would you place on abortion?
Well, if I was queen for a day, I would use shared decision-making between myself and my patients so I could take really, really good care of them.
So you don't think there ought to be any restrictions?
You know, that's not really how abortion care works. We need to be able to take care.
Yes, ma'am, but I'm trying to understand your position first. Do you support any restrictions on abortion?
I support my patients, I trust women, and I know that they're going to make the right decision for themselves.
Okay. How would you change Texas law? Are you suggesting that Texas should adopt a law that's saying there should be no restrictions on abortion?
Are you asking me?
Yes, ma'am.
Yes. If I could change Texas's laws, I would be able to take care of my patients if they're in need without restriction.
I just find it extraordinary that neither you nor Ms. Rivera are willing to say what you believe, which is clearly that you don't think there ought to be any restrictions on abortion. You think it's okay.
He asks Rivera plainly, would she support abortion the day before birth if both mother and baby are healthy? Her answer? She calls that labor and delivery, and insists that kind of abortion doesn't happen. Kennedy responds, so, no restrictions? Not even at 40 weeks? Still, she dodges. It's not just what she says, it's what she doesn't say. Hey, if you're finding this coverage valuable, click subscribe below. We break down congressional moments like this every week. No spin, just facts. Dennard echoes Rivera, no clear line. Kennedy turns to Dr. Dennard. If you were queen for a day, what restrictions on abortion? Dennard dodges. Decisions should be between patients and doctors. Pressed again, she replies, I trust women. No direct answer, no specifics, no restrictions. The clash over language and reality. Then it gets even more heated. Kennedy confronts Rivera about using birthing people instead of mothers. Rivera says it's to include trans and non-binary people. Kennedy's frustration builds. That's a mother. It's a battle over abortion, biology, and identity. Final thoughts. So what did we witness here? Senator Kennedy asked. Do you support any limits on abortion? Rivera and Dennard said, no. It's a pivotal moment in the national conversation on reproductive rights, like subscribe, and hit the bell for more Real Talk breakdowns. Until next time, stay sharp and stay informed.